cholelithiasis, which is also known as gallstones, is a term for the hard deposits in the gallbladder. And in most cases, there's different types of gallstones that form in the gallbladder. It's most common in the U.S. and it affects 6% of adult men and 10% of adult women.
Okay, so today we're going to talk about the anatomy, pathology, and physiology of the gallbladder.
Anatomy includes the liver, the paddock vein, and the gallbladder. The biliary tree in the gallbladder is a pear-shaped organ that represents a reservoir of bile and is popular with the lower edge of the liver. Its length is 7 to 10 centimeters wide by 3 to 4 at the widest part and a capacity of 30 to 50 millimeters.
For the physiology, the gallbladder stores bile when it's not being used for digestion, and a hormone called cholecystokinin is released when food enters the small intestine, causing the gallbladder to contract and secrete bile. The secreted bile helps aid digestive process by breaking down fats and draining waste products from the liver.
The etiology: bile with excessive cholesterol or bilirum, gallbladder that does not empty properly, heredity, obesity, diet, stones mixed with liquid bile can block outflow of the bile from the gallbladder.
So the pathophysiology: some factors are how often and how well the gallbladder contracts, and if it has incomplete emptying of the gallbladder, it can cause bile to become concentrated, and it can cause by high resistance to the flow of bile out of the gallbladder due to the anatomy of the cystic duct. And one of the factors is presence of proteins in the liver and the bile can promote crystallization into gallstones, and then another factor is increased levels of the hormone estrogen that can cause an increase in cholesterol levels in the bile and can also decrease gallbladder movement, resulting in gallstone formation.
Good morning, Mr. Duran. What seems to be the problem today?
I've been having pain in my right abdominal area.
Have you experienced any nausea or cramping?
Yes.
And have you had any indigestion recently?
Yes.
I see. Well, what is your pain from a scale of 1 to 10?
10.
10. Okay, so how long has the pain been going on?
For about a couple weeks.
Couple weeks. Do you eat a lot of greasy food by chance?
Yes.
What type of foods?
Fast food, steaks, eggs.
Well, do you have any medical history of high cholesterol?
Yes.
And do you have any pre-existing blood conditions?
Yes.
And any history of biliary tract infections?
Yes.
I see. Well, I think you may have cholelithiasis, but let me first check with a physical exam and a few lab tests, if that's okay.
Hi, Mr. Duran. I'm going to be your nurse today. My name is Joy. I'm going to do a Murphy sign test on you. I'm going to press on your abdomen, and if it hurts, let me know.
It's right there.
Okay. Well, I'll be right back with you, and let me talk to the doctors, and then we'll tell you what's next.
Okay, so the way to diagnose what Mr. Duran has is 3 types of tests. We can do a liver function test, we can do a ultrasound, or we can do an ERCP. Which one do you guys think would be the best option?
I think we should do an ERCP.
Yeah, because it tests for the bile ducts and the pancreas and the liver, right? Yeah?
Yeah,
Okay, that's it.
How are you doing today, sir?
Good.
I am a gastroenterologist, and according to your test results today, it shows that you do have gallstones. So today we're going to speak on the proper way to treat this. You have a medical condition that mostly concerns the removal of the gallbladder stones. There's different ways that we can cure this, as in self-care, as in low-fat diets that are reducing the intake of high-fat foods, as in dairy, oils, and red meat. We also use a lot of medications, as in cholesterol medication, which lowers your high cholesterol. Erythropoietin is the most common drug, and it basically dissolves the gallstones when they cannot be removed by surgery. So today, The most common surgery for you today will be cholelithiasis, which is basically the surgical removal of the gallstones. We also have a laparoscopic, which is surgery that uses a video camera to thin out the tubes and insert it into the small cuts so that they can continue with the procedure. Okay? Well, today, Mr. Durrell, we're going to do a cholelithectomy on you, and it's basically the surgical removal of the gallbladder.
Cholelithiasis is known as gallstones, can affect anyone and most common in women. Some of the signs in cholelithiasis are sudden pain in the upper right portion of the abdomen, nausea, and indigestion. Gallstones are hard deposits that can be treated by changing the diet. Also, the gallbladder can be removed by a surgical remover called cholecystectomy. In my opinion, I believe that cholelithiasis is a serious condition that can be treated.